I am Sharon Tucker, and I am the Grace Sills Endowed Professor of Psychiatric Mental Health Nursing. I am also a faculty member in the Martha S. Pitzer Center for Women, Children, and Youth. I also hold a title as the Director for the Implementation Science Core in the Helene Fold Health Trust National Institute for Evidence-Based Practice for Nursing and Healthcare here at Ohio State. So I am a behaviorist and a mental health provider at heart, and I study these interventions as well. I mostly look at how to help individuals change behavior through using motivational interviewing and evidence-based approach, and how to help organizations change by changing up the environment so that the best choices are the easiest choices. Right now, I'm focusing on probably three areas. One area is with nurses who have experienced frontline trauma and mental health conditions during COVID and caring for patients with COVID. We are trying to bring interventions to promote self-care and self-compassion, which are highly important elements to maintaining your ability to work. I'm also studying two interventions. One is a NEAT-based, we call it Move More, physical activity intervention, coupled with a sleep intervention for night shift nurses. So we have a grant in review right now, which would be really, really cutting edge in terms of trying to understand circadian rhythms better and how we can promote health and wellness for people that work night shift who have great risks, including cancer risks. And then I'm also spending time nationally looking at mental health conditions, suicide prevention, and fatigue reduction with other nurses and interprofessional teams across the country. The primary things that I coach people on are stress management, mental health concerns, physical activity, dietary, and weight management, as well as some spiritual work, which we bring about through compassion and meditation mindfulness. Those are the issues that I mostly coach people on, and we've had really good outcomes. The reason this is so important and why you should care is that about 40% of diseases are preventable through healthy behavior lifestyle changes. What we have seen in many of the interventions are improvements in body compositions. We've seen improvements in physical activity, minutes and steps per day. We've seen changes in cardiometabolic markers. We have also seen improvements in mental health. And as a mental health practitioner, that's really important because there's lots of times stress and mental health that gets in the way of being able to engage in health behaviors that will promote longevity and quality of life.